So we'll be discussing what is meaning of a receptor and different types of terminologies of the drugs which work through receptors. So first, let's discuss what is meaning of a receptor. A receptor means it's a macromolecular site. It's a part of a cell. Now on this receptor, different drugs they work. Some drugs they are called as agonist, some drugs are called as antagonist, some of them they are called as partial agonist, some are even called as inverse agonist. So we'll be discussing about the concepts of these four drugs. What is meaning of agonist, what is antagonist, what is partial agonist, and what is inverse agonist. Before we understand these four different terms, we need to understand two more concepts. One is called as the affinity and the second is called as the intrinsic activity. Now affinity, as the name suggests, it is an ability of the drug to bind to the receptor. That means if any compound or a chemical or a drug, if it has an affinity for binding to the receptor, that means that drug is going to attach to the receptors, and that is called as the affinity. So affinity is nothing but the ability of that compound to attach to the receptor. Now once the drug is attached to the receptor, the drug is going to produce some changes or some action, and that concept is called as intrinsic activity. So intrinsic activity means the ability of a drug to elicit response after the drug binds to that particular receptor. So having understood affinity and intrinsic activity, let us now revisit those four terms. One is called as agonist, the second is called as antagonist, third is partial agonist, and the fourth is called as the inverse agonist. Now agonist, it has affinity with the receptor as well as it has an intrinsic activity with the receptor. That means when a drug is given, the drug binds to the receptor, that means it has an affinity, and after binding to the receptor, it elicits some change in the cell, and that is called as the intrinsic activity. If we see, or we can categorize this intrinsic activity between say -1 to +1. So the agonist has intrinsic activity of +1. That means the agonist is going to show some change after it binds to the receptor. The second type of drug is called as antagonist. Now again, revisit whether the drug has affinity and what about its intrinsic activity. So the antagonist also has affinity for the receptor. That means antagonist is also going to bind to the receptor. However, the antagonist does not have intrinsic activity. So if you want to categorize or label the amount of intrinsic activity, we can say 0. So antagonist has no intrinsic activity. So what it does? So it just blocks the action of the agonist. That is called as the antagonist. So antagonist has affinity, but antagonist does not have intrinsic activity. The third compound is called as the partial agonist. As the name suggests, it is a partial and it's an agonist. So that means it has affinity for the receptor. That means partial agonist is also going to bind to the receptor. What about its intrinsic activity? Partial agonist has a submaximal intrinsic activity. That means it will not show the response as higher as that of the agonist. So submaximal means the response would be smaller as compared to agonist, and that is why it is called as the partial agonist. In the presence of agonist, the partial agonist blocks the action of agonist. So it has submaximal activity, it has affinity, the response shown by the partial agonist is lesser as compared to that of the agonist. Lastly, what is inverse agonist? Again, on those two components, that is affinity and intrinsic activity. The inverse agonist also has affinity, but the intrinsic activity is exactly opposite to that of the agonist. That means if agonist is showing the intrinsic activity of 1, the inverse agonist has an intrinsic activity of -1. Now, having understood these four concepts, agonist, antagonist, partial agonist, and inverse agonist, let's see which are the examples of these four drugs. Let's first talk about the agonist. So as we said, agonist has affinity also, and it has +1 intrinsic activity. For example, adrenaline. Adrenaline is an agonist at alpha receptors as well as beta receptors. Let's talk about the antagonist. What is the example of antagonist? The example of antagonist could be, for example, neostigmine. It blocks the nicotinic receptors. That is the antagonist. So neostigmine is an antagonist at the NM receptors. Atropine is an antagonist for the muscarinic receptors. So acetylcholine is an agonist and the antagonist is acetylcholine. What is the example of partial agonist? The partial agonist, for example, beta blocker pindolol. Pindolol is a partial agonist for the beta receptors. Second example of partial agonist is pentazocine. So pentazocine is a partial agonist at mu receptor. Now what is the example of inverse agonist? There is an example called as beta carbolin. So benzodiazepines, they are agonist at the GABA benzodiazepine receptor, whereas beta carbolin, it's an inverse agonist. That means it will have the exactly opposite action as that of benzodiazepines. Whereas when we spoke about the antagonist, for example atropine, atropine will block the action of acetylcholine. So atropine is an antagonist of acetylcholine. So let's just summarize what we discussed. So receptor is the macromolecular site as a part of the cell to which the drug is going to bind or the agonist is going to bind and produce action. Depending upon the different types of drugs, the drugs which act through receptors, they can be called as agonist, antagonist, inverse agonist or partial agonist. Thank you.